Today I'm going to be talking to you on the topic of schizophrenia. Schizophrenia is a chronic mental disorder that affects the way people feel and behave. Schizophrenia is just one of the many types of mental disorders known. This disorder is a very complex and chronic disorder, meaning once diagnosed, you cannot simply get rid of this disorder. But it can be treated, and if treated in a timely manner, it can be very manageable to live with. To this day, psychologists and scientists do not know exactly what causes this disorder, but the symptoms do arise usually between the ages of 18 and 24. Symptoms of this disorder can affect you behaviorally, cognitively, and psychologically. Some of these symptoms include aggression, memory loss, anger, anxiety, and loss of interest in certain activities. A lot of people mistake bipolar disorder with schizophrenia because sometimes they can present the same signs. However, they are two very different chronic mental disorders. Bipolar disorder symptoms include extreme shifts in energy. 1 minute you can be highly motivated to do something, and the next you don't want to do anything. Your mood can shift easily. Your activity levels, like I said, can go from high to low really easily. They usually classify these episodes as mania. Sometimes they can even have hallucinations and delusions. Although these signs are some of the same, symptoms are some of the same symptoms of schizophrenia. In patients with schizophrenia, these symptoms are way more severe. Bipolar, however, is a more common disorder than schizophrenia. There are 4 different types of schizophrenia. They are the following: paranoid schizophrenia, catatonic schizophrenia, undifferentiated schizophrenia, and schizoaffective disorder. People who suffer from paranoid schizophrenia have delusions and extreme paranoia. When you suffer from catatonic schizophrenia, you tend to just completely shut down in all aspects, physically, emotionally, and mentally. People who are diagnosed with this type of schizophrenia show no will to do anything at all, including your normal, typical behaviors such as eating, drinking, sleeping. Sometimes they just don't want to do anything. Undifferentiated schizophrenia is a combination of both paranoid and catatonic schizophrenia. These patients suffer from paranoia and not wanting to do anything. Lastly, the schizoaffective disorder is anyone who is diagnosed with this disorder shows symptoms of schizophrenia, but they don't have fully classified schizophrenia, because they also show signs of mental and behavior disorders such as depression or mania. Schizophrenia oftentimes gets delayed treatment because patients don't realize they have it, or their family members are unsure, so it doesn't always get treated. There are 50% of cases go undiagnosed. There is no known cause for schizophrenia. Psychologists are still on the hunt to find the cause, but if you get it treated, it can be very manageable.